We are now recording. Welcome, everyone.
Thank you.
All right. I want to welcome everybody to today's event, The Science of Mood, Anxiety, and Motivation. We've all had a tough, year going on year and a half now with the COVID, with the pandemic. And this is a timely topic here on how to cope with the change in the age of coronavirus. So we hope that you will enjoy, we're sure that you will enjoy today's presentation with Dr. Musai. But before we get to that, I'm going to hand it over to Elijah, who will do a tech review.
Good morning and welcome, everybody. I'm looking to this from the doctor as well. So for those who've come, everything is the same. I ask everybody to take a look at your mute button right now. And if you're not presenting, you could please mute yourself. And you can also see the video. You can have your video on or off. We'll hear the presentation, and then after the presentation, we'll have the Q&A. And everybody with a question will be called on. The better news is you can ask questions in live stream time in the chat section. The moment a thought comes to your mind, you can put it in the chat section, then you can move on to the next slide. And then Stephanie and Crystal will gather those questions, and hopefully most of them will be answered today. And if not, they'll be answered in an email. So mute yourselves, sit back, and we look forward to the presentation. And I'm here on the side. If you need any help, you can just chat me.
All right, thank you so much, Elijah. I'd like to introduce our presenter for today. Dr. Musai is a Western Region Behavioral Health Medical Director for Anthem and a practicing board certified psychiatrist. Dr. Musai trained at UC Davis School of Medicine, UC San Diego, Yale University, and he is a former faculty member with the UCLA School of Medicine. So now I'll give it over to Dr. Musai. Dr. Musai.
Thank you. Thank you, everyone, and good morning to you all. It's a pleasure to be here, and I look forward having a conversation about the impact of COVID-19 on all of us, especially with regards to stress, anxiety, and mood issues. Before we get started, I just had a question for Elijah, so I have a understanding. When would we switch over to question and answer? So I know how much time we have. It's 10:12 now.
At about 10:55.
10:55.
Five to the hour. But doctor, please go. We're
No
interested
problem.
in what you have
Okay.
to say.
Got it. Thank you. So what I hope that we all gain from this conversation today is how we can cope better. So I want to really move quickly through the science and background of anxiety and mood issues, but give you guys all some very practical tools that you can use moving forward. So how do I, as someone, going through the pandemic 1 year after the start of COVID-19, deal with it? What are some strategies or coping skills that I can use on a day-to-day basis? So I really hope that at the end of this conversation that we're going to have, you'll be able to take one or two or more pointers with you and implement those on your day-to-day lives. And again, that's the intent of this presentation. As they mentioned, we will certainly leave time at the end for question and answer. And I really want this to be a dialogue, and I don't want it to be something that is not applicable to you. But so if you have specific questions or you want some clarifications, please ask those questions and let's address them. So these are the things we're going to talk about. We're going to talk about why is COVID-19 amongst all, other illnesses or diseases or pandemics so unique? And certainly, why do we worry during a pandemic? And we'll explain how anxiety is formed physiologically or emotionally, how it impacts us, who's at risk of feeling stressed, anxious, overwhelmed, or depressed, the prevalence of mood or anxiety issues during a pandemic. I also have a very important slide about the stigma of having a mental illness and asking for help, because often that becomes a barrier in feeling better. We'll talk about the impact of not getting help, one of which is unfortunately suicide. And one of the things we really focus on is to look for individuals who may have quote unquote warning signs. How do we identify those individuals? Maybe ourselves, our loved ones, our family members, and how do we seek help? I'll give you some very practical coping or managing skills that we can use, including mindfulness techniques. I'll also provide some information about resources if you need additional help. And then at the end, again, we'll leave some time for question and answer. So let's start about why this is so unique. Why are we all struggling, on this planet? There are a few things that I think are worth noting about COVID-19. One, it's highly unpredictable. If you look in the beginning of the pandemic, everyone had some theories or hypotheses about when will it spike, when will it get better, whether or not herd immunity works. One thing we've learned is it's highly unpredictable. So that by itself creates or fosters a lot of anxiety. So anxiety, by definition, is a fear of unknown. If I don't know something, and if it's unpredictable, there's a state of distress, and I feel anxious or worried because I can't control the outcome. If something is unpredictable, by definition, we can't control, and that by itself becomes anxiety provoking. There's a lot of uncertainty about my job, uncertainty about my family, uncertainty about my health. There's also great discussion and, again, unpredictability and variability about how do we get COVID-19? And quite frankly, that has changed quite a lot in the beginning. Is it airborne? Is it droplet? And that has changed. The mortality rate has changed. So there's a lot of factors that are unknown that by definition can be very anxiety provoking. We know this, if you have access to any social media, there's also been a lot of misinformation, right? About how it impacts us, who's susceptible, how to prevent ourselves, etc. What's also unique is this, unlike any other illness, requires us to isolate socially. We as human beings need social interaction as means of coping with stress, with feeling overwhelmed, with feeling anxious. But everyone is telling us to socially isolate. I really don't like the term. Most psychiatrists don't like the term of social isolation. We prefer physical distancing, but we don't want you to socially isolate. And I'll give you some examples of how to do that during a pandemic. So again, it's important to remember, though we are physically distancing ourselves from each other, it does not mean that we should socially avoid others and essentially stay at home and not have any interaction. Certainly, this has been very important, and everyone's talking about it, the president, the Congress, about the economic impact of COVID. Will I have a paycheck in 2 weeks? Will I have a job in 6 months? As we all know, most stable jobs have been in jeopardy or jeopardized during a pandemic, right? And there's a lot of fear and panic about resources, right? We've talked about, remember in the beginning, there was all these pictures on news about, supermarkets running out of essential toiletries, etc. So there's a lot of panic about resources. And how do we get our needs met when there's so much unpredictability and uncertainty, and there's so much fear of, again, lack of control, not being able to manage those factors. We also worry about, as I mentioned, running out of essential supplies, but we also worry and get anxious when we are separated from our loved ones. You've seen the pictures of individuals who have loved ones in nursing homes or may have been impacted by COVID, and we are told to kind of separate ourselves or socially distance. That by itself creates a lot of anxiety and fear, because our job is to protect our family, our loved ones, and we can't do that during a pandemic. Uncertainty about how long this will stay home. Believe it or not, I made this slide a few months ago, and there's still uncertainty, right? I know we are hopefully moving towards the right direction, according to our governor and our Eric Garcetti, our mayor in Los Angeles, but there's certainly a lot of uncertainty about how long we should isolate. Concerns about physical safety and that of others, right? This has come up a lot. Fear of getting sick. If I get sick, can I get help? Do I have access to help? What would that look like? So again, there's a lot of factors that make this pandemic so unique and why we worry about it. There's also guilt about not being able to do our responsibilities, one of which is work, right? I always bring this in my private practice to my patients, that we're not going to be as productive as we were a year and a half or 2 years ago. So we will have probably diminished accomplishment at work, or ability to take care of our children's or dependents, because everyone is struggling, right? So we need to accept the new normal and have realistic goals or expectations. So our productivity at work would be reduced. Our empathy may be reduced. Our responsibility to our loved ones may be somewhat in jeopardy. What do we do when we are worried and we are anxious? We isolate, we get bored. When we get bored and isolate, we start ruminating, we start obsessing, we start perseverating on things. And you can imagine this negative feedback loop of worry and being alone and not being able to talk to others leads to a lot of challenges, and I'll talk about those. Will I have enough money? What if I get sick? Oh, people need to avoid me because I'm, COVID positive. I may get labeled. We've seen that in certain minority groups, and certainly in the past few months. So please remember, there's such a unique period in our lives that it really impacts us.
What he's showing on the slide.
Thank you. That it impacts us greatly in terms of how we manage our lives. Okay, I'm going to go through these slides very quickly. And the reason I will do that is because I really want to give everyone some tools and not go over the science of anxiety. But the slide is just to remind us that not only do when we are anxious, we have emotional symptoms, right, or psychological symptoms, but we may have also physiological symptoms. We may have heart palpitations. We may have muscle tension. We may get headache. We may get neck pain. We may experience diarrhea or flushed skin. So it's important to remember that anxiety manifests itself, or stress manifests itself, not only as, feeling anxious or worried, but also physically speaking, our body experiences anxiety, okay? I'm just gonna make one comment about the hormone in our brain that's responsible for anxiety, stress, or worry, or depression, called serotonin. This neurotransmitter or hormone is very important. And the way we want to address anxiety or stress is to increase serotonin, right? And there's a lot of ways of doing that. One of which is to increase our social interaction. I'll tell you how to do that during a pandemic. So also other ways is to consider medications if it's indicated, or talk therapy. It's also again, this is important to remember that there's a balance of this chemical or neurotransmitter called serotonin, along with two other hormones called dopamine and norepinephrine. And you can see how they interact, or the interplay is important to having a stable sense of self, feeling not anxious or depressed or stressed. Okay. Let's talk about the pandemic and how it impacts us. We've already alluded to the psychological and the financial impact and the worry about how long the pandemic lasts. But there's also sometimes our feelings may be translated or expressed as anger or irritability or frustration. I think that's really important to note, that we may not just experience anxiety as feeling anxious, but we may experience this as irritability or anger. We may also see changes to our energy, appetite, sleep, right? We may have difficulty going to sleep or staying asleep. We may notice that if we were, prior to the pandemic, had struggles with mood, depression, or anxiety, we've noticed worsening of those during the pandemic. The last bullet point is very important because unfortunately, we've seen this and we've unfortunately predicted this, that when we are stressed, anxious, or bored at home, we're more likely to numb or suppress by drinking excessive alcohol or use substances. And as unfortunately, there's been a significant and sharp rise in substance use during the pandemic, which are very worrisome because they've unfortunately also have led to unintentional and intentional overdoses. Okay, who's at risk during the pandemic to struggle emotionally, right? I have some, essentially, I would say everyone, but I have some people that are particularly vulnerable. right? Those groups are children and teens, right? Because we are socially distancing and they're not attending school and there's been a disruption to their routine. People who are caring for family members or loved ones. That's a very important one to remember, right? Because I'm supposed to be strong. I'm supposed to take care of my elder family member. I'm supposed to be the one who's going to essentially get others through. But I may also struggle. So particularly caregivers are very vulnerable to having mental health issues. Obviously, frontline workers, healthcare providers, first responders, and people who have existing mental health conditions. I think that's important to remember that if you have had depression, anxiety, you're going to be a lot more susceptible to the pandemic and its impact on your mood or anxiety. Certainly people who've lost their jobs are worried about financial outcome. People who've had difficulty due to disability or developmental issues. People who are feeling isolated or living alone. This has been very well studied that some racial and ethnic minority groups are also susceptible. Access to getting COVID tested, access to getting the vaccine, as well as we've seen, unfortunately, that there's been a significant rise in individuals who have acquired COVID-19 and needed hospitalizations in certain racial and ethnic minority groups. So there's a lot of interplay between what we've seen about the racial injustice and the impact of the COVID on us, especially on those individuals or group or community groups. Again, people who've had substance use disorder are certainly a lot more likely to struggle with mood or anxiety or feel stressed. There was a big study done a few months ago, and I suspect, quite frankly, these numbers are doubled or tripled by now. That during the pandemic, this current COVID-19 pandemic, about a third of people had experienced depression and anxiety. And about 1/3, again, 26%, had some stress-related disorders. And about 13% had seen increase in substance use. Again, I think that number is incredibly underreported. I think, quite frankly, the number is more about 35, 40%. What really bothers me as a psychiatrist is the last bullet point, that unfortunately 1 out of 10 individuals had considered suicide in the past 30 days. That's a very worrisome statistic, because those are the individuals who, unfortunately, a percentage of them may actually not get help and act on those thoughts of self-harm. As I alluded in our agenda, I have one slide about mental health stigma. So what happens if I'm feeling depressed or anxious? Am I vulnerable? Am I going to be labeled? Do people want to include me in their activities? Do I feel embarrassed to get help? Who do I get help from? Right? So there's a lot of stigma with saying I have a mental health issue and I need help with it. And certainly, again, we talked about certain groups or communities that certainly there's a very much a taboo in saying I have a problem because you're seen or labeled as weak, which is certainly not the case. I really want to make sure you understand that what we experience as depression or anxiety is not us per se, but it's a manifestation of an illness. Same way that if I have fever, it's a manifestation of having an infection. So understand that you're not your illness is a very important point. That you should not be judged based on what you experience, because that is a treatable condition. And we'll talk about treatment in the later slides. So I hope you understand why it's important to acknowledge that there's certainly a stigma attached to getting help, or acknowledging that I'm feeling overwhelmed, I'm feeling stressed, I'm feeling tense, I'm feeling anxious, I'm having difficulty with sleep, etc. Or certainly endorsing thoughts of self-harm, because we can help with all of that. Speaking of thoughts of self-harm, if our depression or anxiety, or if you're feeling stressed or overwhelmed, is not treated, unfortunately, a percentage of those individuals may have thoughts of self-harm or suicide. These are some warning signs that we need to watch out for in ourselves, in our loved ones, in our family members. If we've noticed that we're drinking more or using drugs, looking for ways or searching for ways of ending our lives, such as methods, withdrawing from activities, isolating from friends or family, sleeping too much or too little, essentially having our quote unquote goodbyes, giving away our prized possessions, feeling aggressive, angry, irritable, or being so fatigued. People who are considering suicide often have one of the following mood issues: feeling depressed or sad or hopeless, feeling anxious or overwhelmed. They withdraw from activities. They're feeling irritable. They may feel humiliated or ashamed. Again, I mentioned anger. And then the last one is, unfortunately, when they see suicide as a solution, they may have a sudden burst of relief or improvement. Again, these are very worrisome signs of suicide. Okay, it's 10:31, so I want to spend the next 20 minutes really talking about practical ways of coping with stress, with feeling overwhelmed, feeling anxious, especially during the pandemic. The number one, and I have a number of bullet points, but the first thing we can do is take care of ourselves. I'm going to give you some ways of doing that. Number one, eat well. Eat a healthy diet, because if we are feeling isolated or depressed, we may not eat as much. We may lose weight. We may lose energy because we are not having nutritional supplements. So it's very important to eat a healthy, well-balanced meal. 3 times a day or as often as you're indicated by your practitioner. So I make that a very important point, because it is very, very important to control the aspects of your life that you can, such as eating well-balanced meals. Okay, everyone says exercise. I love that, but that doesn't mean anything to me. Let me give you some practical ways of exercising that have shown to work. The idea is not to say run or jog for 5 hours every day, unrealistic. No one can do that. I certainly can't do that. But we should have realistic goals about exercise. So we set aside a time every day where, if we can, we go for a walk. If we feel comfortable, we go around the block 2 to 3 times. So the goal is to reach 20 minutes of walking 4 times a day. Now, in the studies, the type of walking that really helped with feeling stressed or overwhelmed is brisk walking, as much as you can, moving your upper, extremities as well as your lower extremities. So walking briskly has shown to help in terms of feeling less anxious and depressed. So what does that translate into? Every day at 9 o'clock, I'm going to put on my comfortable shoes. I'm going to put on my sneakers. I'm going to go walk around the block for up to 20 minutes. Now, if you have some limitations or physical limitations, or certainly if your doctor has recommended otherwise, you certainly have to follow with your provider's recommendations, who know your specific conditions. But the idea is you can start maybe with 5 minutes a day. You can work towards maybe in a few weeks, 10 minutes a day of exercising. So as much as you can, you set aside some time to walk 4 times a day at least. 4 times a week, about 20 minutes per day. Okay, getting plenty of sleep. All right, let me explain how we would do that. Again, you hear this from everyone, but practically speaking, how do we do that? We stop doing activities that keep us alert and awake past, let's say, 9 or 10 p.m. So the recommendation is about 90 minutes before we go to sleep, we turn off anything with screen, our phone, our computer, our laptop, TV, etc. And we do something relaxing or calming. We can read a very, relaxing book, or listen to music, or some mindfulness videos or channels that are on radio, and I can recommend some for you. And then we try to remove distraction while we're sleeping, making sure that the temperature of the room is set that we're comfortable to sleep, make sure we have a comfortable mattress, etc. So getting a restful or sleep is very important as reducing the likelihood of feeling stressed, anxious, or irritable the next day. Okay. Again, we want to set aside maybe 6 to 8 hours a night of getting sleep, removing things that disrupt that are screen time about 90 minutes before we go to sleep, and avoiding any alcoholic beverage up to 2 hours before we go to sleep. Okay. So as much as we can, avoid alcohol or other drugs, especially before we go to sleep. Okay. I alluded to bullet number 2, which was how important it is to connect with others, and not necessarily socially distance, but physically distance. So during this pandemic, we still need human interaction, and we can still achieve that by the following. You can call a friend or a family member or a loved one. You can set aside Zoom or other virtual or video, chat time. Make sure that you set aside some time where you talk to your loved ones. Again, these have to be scheduled. If not, we may not necessarily follow through with them. So remember, I mentioned, I said, 9 to 9:30 is the time we exercise. Maybe we come home, we have a snack. Maybe from 10 to 10:30 in the morning, we set aside a time for connecting with others, and maybe having another time, let's say 4 p.m. to 4:30 p.m. Okay. Taking breaks. Okay. This is very important to do. If I'm feeling anxious, overwhelmed, stressed, it is okay to pause and take a few minutes to go outside, maybe take some deep breaths and do something maybe enjoyable, right? I will recommend some mindfulness or meditation apps that are very useful if you have access to a smartphone and you can download those apps. They're very helpful in terms of managing our stress or anxiety on a day-to-day basis, okay? You have to find ways of reducing anxiety on an ongoing basis, and taking breaks is very important. So every day, maybe you set aside from 12 p.m. to 12:30 p.m. where you take a break and you do something enjoyable. You may go for a second, round or walk. You may call a friend. You may do some mindfulness technique or deep breathing techniques. Or you may do an activity or hobby that you enjoy. Okay. I mentioned misinformation during a pandemic. So certainly it's very important to stay informed, but we have to limit our exposure to news or TV. I'm strongly opposed to leaving the TV on 24/7, because the 24-hour news channels constantly show us things that are distressing or overwhelming, again, not having control over. And it can really, we can obsess and ruminate about what we saw on the news media, and we can start worrying about it and perseverating on it. So maybe setting aside some time where we stay informed, maybe half an hour a day where we, listen to the news. That's it. No more than half an hour a day, or maybe 10 minutes of, social media, whatever platform you use. But we want to avoid exposure to excess news. It can be overwhelming. Quite frankly, it's, I think, overwhelming to anyone, regardless of the pandemic. Try to do enjoyable activities. Though we are going through a pandemic, it does not mean we should give up on our time management skills. We should still maintain some level of structure or routine, right? What do I mean by that? Trying to wake up around the same time, trying to brush our teeth around the same time, trying to have snack around the same time every day, trying to eat around the same time, trying to exercise around the same time. Try to schedule some hobby that we enjoy every day, right? So it's really allowing ourselves to have an outlet to express our feelings or emotions, either through a hobby, either through exercise, or communicating with our loved ones. I have some more suggestions that I think are important. I mentioned the daily routines, okay? I like the pen and paper, but you can certainly also use a smartphone, of maintaining a daily routine. When do I wake up? When do I have to do my errands? When do I take care of my exercise, etc.? So everything you want to do during the day, make sure that you write it down in your schedule or in your calendar, and have a consistent pattern of taking care of yourself on a day-to-day basis. Okay. I mentioned point number 2. I keep reiterating this, that you should not isolate from others. Okay. So you maintain relationships to really address or combat anxiety. And the way you do that is you call people. You engage in some form of video conferencing. You may be able to do a social distancing outdoor with masks, chat with someone, etc. So find ways of connecting and giving up on the urge of isolating and withdrawing. I mentioned limiting screen time. The last one is practicing gratitude. This is very important. Every day, maybe writing down 5 things that we're thankful for. This, you have to be specific. I'm thankful today that, I had an opportunity to say hi to the clerk at the gas station, or I'm thankful today that, my medications arrived, or I'm thankful today that, I was able to see my loved one. So every day we write down 5 things, or certainly can write more, of things that we are thankful, that we either accomplished or we stopped and paused and appreciated what we have. So these are positive attributes of ourselves or others, and acknowledging them by writing them down. Okay. If you were to take a picture, a screenshot of all the slides, I think this is the slide that I want you to have, okay? Because it really does a nice job of encompassing all the things we've talked about thus far. Staying connected with our loved ones via phone call, text, social media, or video calls. Stay informed about, our CDC guidelines, about County Department of Public Health recommendations, but we limit our screen time to no more than 30 minutes or 40 minutes per day for the media or the news, okay? Avoiding constantly looking through the social media is one way of managing our anxiety, because those things we have control over, right? The parts of our lives that we have control over, if we manage, it significantly reduces anxiety, right? We monitor our physical health, not just emotional health, not just expressing when I'm feeling anxious or overwhelmed, but also watching our body and listening to our body. I'm feeling stressed because my back hurts again, or my neck hurts, or I'm having a headache, or I have heart palpitations, or I have sweaty palms. And making sure that we eat healthy foods, right? That's very important. And drinking plenty of water. So it's important that, again, during this pandemic and making sure that we follow through with the pandemic guidelines, we're still able to exercise and walk, right? We can wear a face mask. And again, with the social distancing, we can go for a walk. So no one has said we should ban exercise or stop interacting with others. Okay. Hold an image in your mind of the best possible outcome. Let me explain this. I'm really worried. I'm going to lose my job, because if I lose my job, life is going to end. I won't have money. I'm going to, not have a place to live. If I don't have a place to live, and I might become homeless. If I become homeless, I don't have much food. I'm going to get overwhelmed and I'm going to die. You see how this obsessive rumination and worry can lead to catastrophizing, thinking the worst case scenario. And that's all within our mind. This is something we have control over. What if we said the opposite, right? What if we trained our brain and said, despite the challenges, I have control over daily life. I'm going to continue to exercise. I'm going to reduce or mitigate my risk of feeling stressed or anxious. I'm going to stay happy, and I'm going to enjoy the time I have today and do the things I enjoy regardless of the future outcome. So we create a more positive narrative about our lives and what our future would look like. Okay, because constantly during a pandemic, we think the worst case scenario. We all do. I do it too, right? We catastrophize. We black and, oh my God, this is going to happen. And the variant is coming, and everyone's going to catch the virus, and the world is over. But it's important to challenge that negative automatic thoughts. Make a list of our strengths, right, of ourselves and others, and talk about how we've been able to overcome our past struggles and how we have resilience or ability to cope with life given our past successes. If you belong to an organized religion, or if you practice any mindfulness or meditation techniques, they're wonderful to engage in even during a pandemic, right? There may be sermons, or there may be opportunities to connect to your spiritual advisor via Zoom or other platforms, and not necessarily in person indoors. Okay, some more mindfulness techniques that, again, I think are very, very practical, except that you will not be as productive as always. I mentioned this first. Acknowledge our shortcomings, acknowledge our frustration, acknowledge that we're going through a pandemic, and accept that we may not feel as well as we did 2 years ago. Setting realistic goals. I use the exercise as an example. The goal is not to be a marathon, runner by tomorrow midnight. That's not realistic. But what if we gradually increased how many minutes we go for a walk? Maybe 5 minutes first day, maybe 10 in a month, maybe in 2 months, 15 minutes, etc. Create boundaries and minimize distraction. If you're working or you're attending to a task, make sure that you allow plenty of time to engage in self-care or taking breaks. So if someone comes to you and says, hey, let me have you do something else, if you're feeling overwhelmed and anxious, it is okay to say, no, I'm not today. I'm not feeling well. I don't feel like I can take on that extra task right now, right? And not feeling overwhelmed or pressured by constantly checking our emails and feeling we have to be responding 24/7. Okay, I mentioned connecting with colleagues, friends, and family. The quote unquote, the virtual coffee break is one way of doing that, right? Like using FaceTime. Prioritizing well-being. This will not happen unless you allocate a dedicated time to do this. So from 11 to 11:30, I may do some drawing, I may do some crocheting, I may, call a friend, I may go for a walk, I may exercise, etc. Set hours and stick to them. If you have an ability to work, or you want to take on some goals in retirement, whatever the case may be, set specific goals to accomplish them, right? You should not be working on them at a time when you should be exercising or getting good night's sleep. So again, as much as we can, create and maintain a daily structure or routine. Okay. What if I did all of the above and it's not enough? What if I'm still feeling anxious or overwhelmed? What if I have those thoughts of hurting myself? What can I do? Certainly, you may need to seek professional help from a mental health provider. They include psychologists or psychiatrists or counselors or therapists. I wrote those 4 terms down because they're all, are used somewhat interchangeably, but they're all considered to be mental health professionals. You can certainly utilize your health plan's resources, and LACERS has certainly plenty. You can contact the Employee and Family Assistance Program. You can consider virtual or online resources such as telemedicine, right, or telepsychiatry. Anthem has Life Health Online, and again, most health plans have their own version of telemedicine or telepsychiatry. And consider mindfulness or meditation apps. I'm not going to name the for-profit ones here. There are certainly 2 very popular ones. I will mention one that's free. It's called the Mindfulness Coach by the VA, Veteran Affairs, by US government. I really like the VA one. It's pretty good. Again, I think it's as good as the 2 commercial ones available, and it's completely free of charge. And again, it's by the Department of Veteran Affairs. So if you like, you can download mindfulness meditation apps. And again, allocate time to do them. You can't just download and say, oh, I'll get to it whenever I can. Every day from 11 to 11:20, you may open up the app and engage in the mindfulness exercises. I have put some resources for you guys to remember if you feeling like you need help. And these numbers are available 24/7. The Disaster Distress Hotline, the National Suicide Prevention Hotline. You can talk to a crisis counselor at any time if you're feeling distressed or having thoughts of hurting yourself or thoughts of hurting others. The phone number is 1-800-273-8255. I will mention it again, 1-800-273-8255 or 273-TALK, T-A-L-K. I stopped doing this, but gosh, about a decade ago, I would make my patients memorize this phone number. And believe it or not, so many of them would tell me later on that they're so thankful because at 4 a.m, when those thoughts wouldn't go away of self-harm, they had not the number memorized and immediately called. So write it down or jot it down, 1-800-273-8255. The National Domestic Violence Hotline, Child Abuse, Sexual Abuse, Elder Care Locator, and Veterans Crisis Line. Again, those are all listed as resources for you. And again, certainly your plan may have specific resources for your needs. It's 10:50, so I finished exactly 10 minutes before time, so we can open it up to question and answer and have the next 10 minutes to answer any if there are.
Thank you. We definitely have some questions, Doctor, and thank you for that fantastic presentation. We are going to start with Nancy Castles. So Nancy Castles, I'm going to ask you to unmute yourself, and she has a great question.
Dr. Musai, you had indicated to turn off all screens 90 minutes before bedtime and do something relaxing like reading, or in my case, puzzles and reading. But I do that on a Kindle. So that's a screen. How do you work that?
Great question. I love that question. Nancy, that's a wonderful question. By the way, puzzles is a great way of calming. I personally, when I do puzzles, I get overwhelmed because I'm not good at puzzles. So often I get more anxious when I do puzzles. But your point is a very good one. That's a very healthy way of coping and relaxing. So what do we do? So a lot of the new technology, Nancy, including Kindle, have removed the blue light, which we know interferes with our sleep cycle. So you can go to the settings of your screen, whatever platform you're using, Kindle or other ones, and make sure that you reduce the blue light or blue exposure. And that's seen to help. Kindle does a really good job with that, quite frankly, Nancy. So I'm not as worried about Kindle as other devices. But certainly my phone may be a bad one, or laptops are very bad, or things like that, or iPads. But again, you can go to the settings and adjust them. And I'm sure Elijah knows a lot more, the tech expert, about how to do that to avoid decreased exposure. Thank you for that wonderful question. That's a great one.
Great. We are open to questions from the Lacers folks. Anybody?
I have a question. When it comes to helping someone that you think may, have expressed suicidal thoughts, as a loved one, how do you help that person? What do you say, or what do you do?
Okay, I love that question. Thank you for asking that question. That's a great question, and we can spend honestly hours talking about it, but let's talk about it. First thing I would ask is, how long have you had these thoughts? Are you likely to act on them? And do you have access or means? Okay, if someone tells me that I've been thinking about it, I've researched and I've planned it, and I purchased a gun, and I plan on, implementing this, I would immediately call 911. Okay, and I know a lot of people worry about calling 911. Now, my background, I was a medical director at the VA hospital in West Los Angeles, VA. So my passion is taking care of veterans. And I was an emergency room psychiatrist at the VA, and I worked very closely with LAPD those 9 years. When you call 911, it does not mean that the police are going to come and arrest us. And I know that was a big fear of our veterans. And I, as an ER psychiatrist, I'm very aware of, the challenges we've had recently of calling the police for help, and given the environment in the past, year we've gone through. But what's supposed to happen is, there's 2 to 4 SMART teams. These are LAPD officers that are also mental health workers. They will respond. Now, if those 2 to 4 units are on a call, they often are, as you can imagine, they cover the whole city. There will be other uniformed police officers that respond, but they contact the emergency room and have a constant dialogue with the psychiatrist to bring that individual to the emergency room. So my point is, if you should not be able to manage this because we are not a mental health provider, if it's a loved one, to your point, if someone has means, has access, intent, and planning of hurting themselves, please do not wait a second. Call 911 and let experienced professionals manage that. What will happen is I joked around in the emergency room as I consider LAPD as a free taxi ride, right? They will bring the individual to an emergency room for a psychiatrist to do their evaluation. Okay, so first thing is we want to ensure that they're safe. Now, what if someone is not to that extreme, right? What if someone says, you know, I've been thinking about it on and off. No, I would never act on it. No, I don't have any intent or plan. No, I do not have access to weapons, okay? What I would do is I would encourage them to seek help. Now, I would never say, don't ever act on it because that's selfish of you and I'm going to prevent you from doing that. You can't take that on, right? If someone really wants to commit suicide, unfortunately, they will find means of doing that. But I would be a source of support. I would say, how can I help you get help and see a professional? Can I give you some numbers? You need help getting to the location? Can I drive you there? Right? And if they have an established provider, let's say they have an established provider, and you're really worried that in the past couple of days, they've been talking more about suicide, please call the provider and leave a voicemail and tell them your concern. You see what I mean? You don't need, you don't need to release information. You're not violating HIPAA. You can always give information to a provider, though they may not be able to give you information about their clients or their patient. So essentially, I want you to ring the bell and let a provider, a mental health professional know, and they should take over from then onward. Make sense? So, because if we try to do this on our own, A, we will feel overwhelmed. Number two, we're ill-equipped. Number three, if they act on the suicide, we will struggle with guilt for the rest of our lives. And I've seen that way too often, quite frankly, right? If you're not an experienced mental health professional, let us handle it, right? Let LAPD handle it. Let the crisis team handle it. Let the psychologist or the therapist or the psychiatrist handle it. So it's important to be supportive. It's important to ask questions and make sure they don't have access to weapons. Now, most police departments, let's say they have a gun and I did this at the VA all the time, and I worked very closely with the VA police. If they have a weapon, you can certainly, some police stations have programs where you can go give the weapon to them and they would hold it for you. They're not confiscating it until you get better. You see what I mean? Now, you usually have to call ahead. Don't walk in with a weapon to a police station. Certainly that's not recommended. But I did that all the time. I would call, the VA police. I would say my patient who's, struggling with depression and anxiety has a gun collection. Can we keep them at the police station? They do that all the time. And I would walk with them to the VA police station. They would, keep and then they give you like a tag. And then when you're feeling better, you go pick it up. So no one's taking away your weapons, but I want to make sure my patients who have a lot of trust in me, and I had a lot of trust in them, stay safe. Why? Because if it's 3 a.m, I'm distressed, the thoughts are not going away. If I have access to means, I'm significantly more likely to act on it. So we want to remove access to means, not you personally, but we as mental health professionals or law enforcement. So I would be supportive to your question. I would ask those few specifics, and then I would make sure that they seek professional help. I hope that was helpful.
Yes, it was. I have a follow-up question.
Please.
How do you deal with the stigma around mental health?
Okay. So I have a spiel, and I'm glad you asked that question. So I will give you my spiel. I use a lot of humor in my private practice. So I say, I'm a medical doctor, and I'm a psychiatrist, and if I was smart enough, I would have become a surgeon. So I usually, again, bring a lot of humor about what I do. But I say that as a medical doctor, which is true, I look at mental illness the same way I look at diabetes or high blood pressure. To me, it's a chemical imbalance. In fact, my background, right, I went to medical school and I did my residency, is to treat high blood pressure and diabetes. So as a psychiatrist, I do not see it any different than any other condition. And I remind them that most, if not all, mental health professionals feel the same way. Now, they say, Dr. Musai, that's great, but in my culture, it's a weakness because they say, suck it up, go exercise, and you get better. And then again, I use my humor and I say, it's like saying someone who has cancer Suck it up. Get over your cancer, right? Come on, snap, snap. Get your blood pressure back in control. Why are you so weak? Get your blood pressure back in control. Come on, get your blood sugar in control, right? I joke again a lot with patients. And it's really eye-opening when I use those extreme examples of how similar and how funny it sounds that we have a completely set of biased, right, approach to your point against getting help for mental health versus getting help for diabetes. No one is ashamed of getting help for diabetes or blood pressure or cancer or if I broke my arm. Why is it any different for mental health issues? So I say it the way, I joke around, I say, to me, it's the same. Same books, same training, same background, same understanding. It's a chemical imbalance. And again, I joke around and I say, gosh, I wish I was smarter to do more for you. But all I can do is fix the chemical imbalance. And you fix the chemical imbalance by exercise, which we know increases serotonin, by getting talk therapy, which increases serotonin, and our antidepressants, medications that I prescribe frequently, also increase serotonin. So I use the same analogy to, again, high blood pressure or diabetes to make them understand that. Now, let's talk about this. I have a lot of patients who feel uncomfortable seeing a provider that's of a different race or ethnicity or background, okay? So that comes up a lot, especially if their preferred language is not English, okay? So what I do is then I try to work with them and find a provider that they feel there's a connection. But believe it or not, a lot of patients prefer not to see a provider of the same culture or ethnicity because of a fear that they're going to be judged in that community. Does that make sense? So it can go both ways. So I usually ask the patient, what's your preference? Who do you feel comfortable seeing? Man, woman, what ethnicity, what race, what age group? And I try to remove any barriers in them getting help. Any other questions? I know it's 11:02, so I'm mindful we should stop, but. Elijah, I see you talking, but you're on mute, so I don't know if you had questions.
I'm waiting to see if anybody from our guests have any further questions and expand on anything, want to know if they can access further questions. Is there anything in the slide panel you would like to review? All right. Great job, doctor. You got all the information out there.
Someone said, this is an amazing class. My pleasure. I hope this was helpful. And if there are any questions, you can certainly forward them to people on the panel, and then I'm happy to respond to them via email. Thank you, everyone. Please stay well and know that there's help if you need it.
Actually, I have a question, Anna. And I was thinking about, I think you mentioned early on something about like a mental history of some. And recently a nephew had shared that one of his elementary school kids was having some issues. And so I just want to provide, some of the resources that you provided today. But I think I was more curious for maybe someone that's had it or a history, or what can you say about that? Maybe they've had it early on or not, or does it something that kind of comes and goes depending on the seasons of our lives?
Sorry, they've had what? I'm sorry, I don't.
Like like a history of mental illness or what, So
great question. It depends, what that mental illness was, and it depends if they were getting treated, and it depends if it was trauma related. So it's a question, unfortunately, requires extensive, not information and other data points to be able to answer. So it really is something that someone should speak with their mental health provider or psychiatrist about, because it depends how many episodes they've had. It depends what treatment course they've had, what their response has been. Again, there's like 20 factors to consider that we, look at.
Okay, thank you.
Thank you. All right, I know, again, I don't want to go over time. Thank you, everyone. And I enjoyed having this conversation with you all.
Thank you, doctor. Virtual claps from everybody.
Thank you. Bye-bye, everyone.
Bye.
Thank you.
Bye-bye.
Thank you, Dr. Masai.
So now we're going to move to Crystal. Crystal has Stephanie have some remarks for us.
Okay. Yeah, I'm still having problems with my camera, but Yeah, so basically, what we have coming up very, very soon is our Aging Mastery Program. It's better known as AMP. That will start on March the 30th and will go, wait a minute, hold on. And we'll go through April the 29th. Okay, so we're actually going to have 3 sessions this year. So this will be via Zoom. And anyone interested in participating in this 5-week class should go through your My Lacers to register for it. Okay, it's going to cover things like what the whole aging mastery process is about, exercise, eating healthy, hydration, financial wellness as well. So it's a whole gamut of things that's going to be talked about during this class in this session. Also monthly, we're having our technology events that's hosted by our man himself, Elijah, with Mom's Computer. Thank you, Elijah. The next class is coming up on April the 7th. So any technical challenges you may be having with your computers, cell phone devices, if you need assistance learning about Zoom and anything you may have that you need answers for, attend this technology event on April the 7th, register via My Lacers, and you will get your questions answered.
We'll be addressing that. Let me just say, it was a great question about how you can block the blue light. You know, even if you're on a laptop right now, you've been on for an hour and a half. I put that in my notes. Come to class and we'll discuss that.
Okay, good. That's really good to know. I mean, because, you know, the more that we're on virtually with these events and things, the more you're starting to learn, just like with my camera issues here. We're also on April the 7th. And the technology event is from 2 p.m. to 3:30 on April the 7th. We also have a Silver Sneakers one-on-one webinar, which will be on April the 7th. We have with the County of LA, a well-being webinar that's going to be talking about sleep isolation and resiliency. And those will be held on April the 14th, the 21st, and the 28th. So please go online and register for those. And some of you may already be participating in our champion-led virtual book clubs. We have Janet West that leads one, Jeanette Allen, and Bernadette Arzu that leads our book clubs. You can go online or send an email to the Lacers Well team to join one of the book clubs. And we have started our movie club. Okay, we have one club led by 2 of our champions, Jeanette Allen and Retna Jones. And if you're interested in participating, their first meeting will be held via Zoom on March the 20th as a meet and greet and to discuss movie selections and options and so forth. And then we have our hula class, Beverly Anderson. I believe she has a couple classes twice a week. You can go on to the Lacers web page to get more information about that if you want to participate in that. So those are our activities, and obviously they're all free. So please go online and register. Okay, back over to you, Stephanie or Elijah.
Thank you all Lacers members for joining us for today's event. A special thank you to the Anthem team that has joined our event. Thank you so much for your support, who sponsored today's presentation. Thank you to Dr. Musai. Learned a lot of great information. I will get that information on that slide out to everyone at the conclusion of the event. And also just, you know, as Crystal indicated, look out for more. We're planning more and more events for you. So look out for more on our Lacers event page. You can register for events on your My Lacers account. So we really are working hard to bring you more content. If you have any suggestions for topics you would like to hear more about, send that to our Lacers Well email address at lacerswell@lacers.org. And we would be more than happy to get your suggestions for topics for the remainder of the year, as well as our planning for next year. This is your program, and we want to make it beneficial for you. So with that, if there's nothing else, everybody have a great rest of your day and happy St. Patrick's Day. Bye, everybody.
Thank you. Bye.
Thank you.